What do oligoclonal bands mean in Ms. Lumbar Puncture results? Imagine a spinal tap that helps doctors peek inside your central nervous system to see what's happening immune-wise. Oligoclonal bands are tiny patterns of antibodies found in the fluid around your brain and spinal cord. These patterns are detected through a special lab test on cerebrospinal fluid, which is the clear liquid surrounding your brain and spinal cord. When these bands show up in the cerebrospinal fluid but not in your blood, it suggests that your immune system is active inside your central nervous system. In multiple sclerosis, the immune system mistakenly attacks the protective covering of nerve fibers, called myelin. The presence of oligoclonal bands indicates that your immune system is producing specific antibodies within your central nervous system, reflecting ongoing inflammation. More than 95% of people with confirmed multiple sclerosis have these bands, making them a very useful marker for supporting diagnosis. However, having oligoclonal bands does not mean you definitely have multiple sclerosis, because some other neurological conditions can also cause similar immune activity. The process involves collecting cerebrospinal fluid through a lumbar puncture, which is a procedure where a needle is inserted into the lower back. The sample is then analyzed using sensitive techniques to identify these antibody patterns. The test compares the cerebrospinal fluid with your blood serum to see if the immune activity is happening inside your central nervous system specifically. If two or more unique oligoclonal bands are found in the cerebrospinal fluid but not in the blood, this is considered a positive sign of immune activity related to multiple sclerosis. Finding oligoclonal bands supports the diagnosis when combined with other evidence like magnetic resonance imaging scans showing lesions in the brain or spinal cord, and your clinical symptoms. It's especially helpful when your symptoms are not clear-cut or when imaging results are inconclusive. While advances in MRI technology have changed how we diagnose multiple sclerosis, oligoclonal band testing remains an important part of the process, especially in complex cases. In summary, oligoclonal bands are specific antibody patterns found in the cerebrospinal fluid that indicate immune activity within the central nervous system. Their presence is a strong clue supporting a diagnosis of multiple sclerosis, but they are not the only factor doctors relying on. The test involves a lumbar puncture, which is generally safe but does carry some small risks. Once multiple sclerosis is diagnosed, oligoclonal band testing is usually not repeated, as it mainly helps in confirming the diagnosis when the clinical picture is uncertain. Always remember, each person's experience with multiple sclerosis can be different, and diagnosis should always be personalized and guided by a healthcare professional.